Rapid technological advancements in the digital world have been revolutionizing healthcare in recent years, paving the way for digital health to become the next big thing in healthcare. Digital health is the application of digital technologies in healthcare, which include mobile health, health information technology, wearable devices, telehealth and telemedicine, as well as personalized medicine. Today, artificial intelligence (AI) has become a part of our daily lives, keeping us connected through our mobile devices such as smartphones and smartwatches, to name a few. Information and communication technologies (ICT) and artificial intelligence (AI) are at the core of the development and innovation of digital health. Digital health tools are notably effective as they have the potential to increase a practitioner's ability to accurately diagnose and treat disease and ultimately enhance healthcare delivery. Keen to start a future in digital health? Learn more about the IMU Digital Health Program. There are many universities that offer courses in computer science, which is the foundation of digital technology. However, what is the recommended pathway to major in digital health? Good news! This year, International Medical University Malaysia is launching its Bachelor in Digital Health, the first of its kind in Southeast Asia. For postgraduate applicants, IMU also offers Master in Health Informatics and Analytics. What's great about digital health is that it is open to all students from both science and non-science backgrounds. Data science enthusiasts with a keen interest in digital health and health analytics should apply. IMU's digital health curriculum is built on the foundation of research-led teaching and is led by experienced lecturers from various digital and health science backgrounds to deliver evidence-based knowledge and practice in the industry. Students will also gain valuable knowledge from industry experts and adjunct professors from universities in the US and the UK. Prepare yourself for a rewarding career in digital health now. Learn more about the IMU Digital Health Program.
Hello, everybody. Good morning, good afternoon, and good evening, ladies and gentlemen. Thank you very much for spending your time with us for a live session of a webinar. So, before we continue our session, please allow me to introduce myself. I'm Dr. Waikit. I'm from Center for Digital Health and Health Informatics from International Medical University. So, hello, everybody, and thank you again for being here. So before we continue, I just wanted probably to give you some housekeeping announcement. Only have three housekeeping announcement. Number one, we have already muted microphone for all of you. So if you have any question and also feedback that you have for us, please use the Q&A panel, which you can see from the bottom of your Zoom. And this live session will be recorded. So with that, I think we can start our session today. So again, I want to welcome all of you to this session. And this session, basically, that we have titled this session to be a future of digital health and career pathway. We are trying to explore this particular topic both in locally and also internationally. So the webinar basically will focus on the future of digital health and also career pathway. And we are actually very happy today that we get to invite five distinguished speakers here for today's session. So I believe you can see, from your screen that there are five of us, well, including myself, is six of us. So please allow me to welcome all of our speakers here. So first we have Dr. Muhammad Aizuddin from the Institute for Clinical Research from the Ministry of Health. Welcome, Dr. Aizuddin. Followed. Thank you, Dr. Aizuddin. Then we have Mr. Freddie Lu. He's the Director of Customer Engagement AI and Analytics from FusionX International. Hi, Freddie.
Hello, hi all.
Hi. Next, we have Professor Dr. Shankar Srinivasan, the Chair and Professor in the Departments of Health Informatics, Rutgers University School of Health Professions, all the way from United States. Good morning to you, Prof.
Good afternoon and good evening to all of you as well. Yes. Thank
Thank
you.
you.
Very
Thank you so
honored.
much, Prof. Thank you for accepting our invitation here. Next, we have Dr. Helmi Zakaria, also another important person in Malaysia. He's the CEO for Hayat Technologies. Later, we're going to hear a lot from Dr. Helmi to talk about his work. Welcome, Dr. Helmi.
Thank you.
Next, we have Dr. Tan Yixiong, our program director in International Medical University. Dr. Tan is a program director in Bachelor in Digital Health in IMU. Thank you, Dr. Tan, for being here.
Thank you. Hi. Good
Hi.
evening to everyone. Good morning to Paul Shankar.
So yeah, so I'm gonna start the discussion. Before we go into a discussion, I think it's wise that I read you some bio data of our speakers. After all, you must have think, why should we, why did we even invite these speakers? Obviously, these are not small people. So please allow me to read the bios. So I'm gonna start with Dr. Aizuddin. Dr. Aizuddin is the current head of Digital Health Research and Innovation Unit under the Director of Institute for Clinical Research at Ministry of Health Malaysia. He completed his degree in biomedical and worked in a medical lab since 2007 and subsequently graduated with a medical degree. He's now in his 10th year serving in various positions within the Ministry of Health, including in the surgical fraternity in clinical field, clinical research in Hospital Sungai Buloh, and together with his team, they created digital health research and innovation when digital health demand was booming at the Ministry of Health. The team aims to incorporate digital health solution in clinical research and has been doing that since 2020 with various project portfolio under Dr. Aizuddin's leadership. His research interests and involvement vary from entomology, non-communicable disease, communicable pathology, surgical, and now in digital health. So again, welcome, Dr. Aizuddin.
Thank you.
Next, please allow me to share with you Dr. Helmi. Dr. Helmi Zakaria obtained his medical degree from the Russian Federation and a master's in international public health from the University of Liverpool, United Kingdom. His professional journey began in public health, serving as district program manager for the National Tuberculosis Control Program. In 2017, he pivoted as the digital health entrepreneur with extensive experience in leveraging big data analytics and artificial intelligence in the field of medical epidemiology. In 2019, Dr. Zakaria was appointed to the prestigious WHO ITU Working Group for AI in Outbreak, a multi-institutional and global platform dedicated to harnessing the power of machine learning to mitigate disease outbreak. During the pandemic years, Dr. Zakaria founded Selanka, the Selangor State Digital Health and Welfare Platform, further solidifying his commitment to advancing digital health solution. He was also appointed as the member of the Selangor Public Health Advisory Committee. Welcome, Dr. Helmi.
Thank you.
Next, we have Mr. Freddy. Mr. Freddy Lu is a former management consultant, speaker, and data analytics practitioner who values culture, human centricity, and excellence. Trained as a computer scientist in AI and security, Freddy has more than 22 years of experience in consulting clients on data and digital, and also has first-hand experience in building data teams and data businesses for multiple corporations. Freddie brings a unique blend of global perspectives, having served international clients with a local lens, having led analytics transformation for local businesses. Freddie has built several large data businesses from ground zero. He believes deeply that people is the cornerstone to unlock value of technology. He has been trained as a certified negotiator and certified behavioral interviewer. He also spends a lot of time and energy in training and engaging communities to share his passion on data. He can be found regularly on the circuit speaking at various technology and digital conferences, particularly across the potential of analytics as a critical differentiator for the future. At FusionX, Freddie focused on developing new lines of business while also spearheading the client's data transformation journey. His passion lies in developing team culture and leveraging the power of technology to transform the way we work. So when Freddie is not working, he loves to dive head first into some random hobbies. So the latest is actually bee farming and hydroponic. Wow, I guess we're going to talk about smart farming in a while,
Yeah.
Freddie. All right, welcome, Freddie. Thank you so much to be here.
Thanks, Doc.
Thanks. So we have Professor Shankar Srinivasan, currently a professor and chair of the Department of Health Informatics at Rutgers University. He also served as program director for the Master of Science in Health Informatics and the Doctor of Health Informatics degree program in the department. His research interests are mainly in the area of health outcomes research and AI application. And he has published in various peer-reviewed journals and international conference proceedings. Again, welcome, Prof. Shankar. Thank you so much for being here.
Thank you.
Thank you. Next, we have Dr. Tan. Dr. Tan is an academic with a background in computer science and specialization in data science, digital health, health informatics, and analytics at the Center for Digital Health and Health Informatics at International Medical University School of Medicine. She has been in academia for the last 20 years and conducted numerous training workshops in computer programming, as well as health informatics and analytics for adult learners. She's a member of the Association of Computing Machinery and a researcher working closely with faculty and students at IMU for health data analytics, AI, and also information system. Dr. Tan is also a program director for the digital health program and a senior lecturer, and she received her Bachelor of Computer Science, Master of IT, and PhD all from Monash University. She also supervised students and examine theses from various universities that major in computer science and health informatics and analytics, all related to data analytics topic. Thank you so much, Dr. Tan. Oh,
Thank you.
that concludes the reading of the
The
biography.
introduction.
Yes, and that is like a long list of that. So I think without further ado, I think I want to dwell into the first question. So today, really, we're going to talk a lot about future of digital health, the career pathway, and all. So I'll probably start the first question by asking Dr. Aizuddin to perhaps let us know a little bit about digital health effort in Malaysia, perhaps specifically from the Ministry of Health perspective to share with our audience here. The time is yours, Dr. Aizuddin.
Okay. Do stop me when I go abroad.
No problem. Thank
So,
you.
I think we should start with the country first. So, we've been talking about Malaysian plan, to Malaysian plan. So we're talking about digital economy blueprint, and we also have our IR 4.0 policies, and then so it goes all back, all those trickle down back to MOH, or Ministry of Health Digitalization Strategic Plan 2021 to 2025. There we align ourselves with all these plan that our countries have discussed and planned. We've been talking about digitalization for MOH for, I think, since I joined MOH a few years back already. I think Dr. Helmi also can agree that it's being the longest. But I think the challenge is because we are big in industries and ministries, so there are a lot of stake, but we are moving forward. So I'm happy to say that there are a lot of digitalization plan, and some of them now actually already come to fruition. You can see that we already have open data to begin with. One, there's a good move towards positive. I think back then we did research priority area in MOH, and it also aligned with this digitalization or digital health in a big picture. Yep.
Sure. Thank you for that. But maybe can you share with us a little bit about the research approach from ICR point of view?
Yeah. So for NIH, we have 6 institute. We are from Institute for Clinical Research. And my unit specifically looking at how we want to assimilate the technologies in terms of clinical research. You know, our traditional job are doing clinical research, clinical trials. So now we are bringing technologies to the field of clinical research. And I'm happy to announce that we also have established clusters that will support us in terms of research funding. It's not huge funding, but it's already a start. So, but the grant is only for MOH staff. So I would like to see more collaboration so that we can tap into these opportunities. Example of a research that we did within our unit. And together with our partners, we have Call Sound, using AI to detect COVID-19. So that as a pre-screening tool. And we're also now looking into virtual reality for mental health. On top of that, we also venture into IoT and some small projects on additive manufacturing. Yep.
Right. So maybe if we dwell a little bit more about, some of these projects, perhaps, as a surveillance or maybe as rakyat, we can't see, this kind of projects. Maybe you can share with us a little bit, like, I understand that the efforts could be very small currently, maybe it's only at the ministry level, but what are the future plans? Like, is there any plans to say like implement to the whole Malaysia so that all of us can participate in that?
Yeah, so thank you for that question. So we're always looking at how we can scale up our research and bring citizen science kind of concepts and all. So moving forward, there are a lot of all this research we actually involve. In fact, from the beginning, our unit is starting involve a community when we design the studies. Not in really the early stage, but when we start doing the studies, we involve communities and we're looking at others partners as well. I think when it comes to scalable, our job at this point is actually to provide evidence for the ministries to adopt. We know that the technology is moving very fast, but we are looking into how we can, catch up with this. At the same time, deliver better service. You have to remember there are digital divide also, so we have to think about that as well moving forward. Yeah.
Right. So I want to dwell a little bit, Dr. Aizuddin. So you come from a medical background. So just like as we read through your bio, you come from a biomedical background. After that, you become a doctor. Pardon me for that, medical doctor for that. Now you are in research. So you have seen, how it evolves all the way from the lab perspective, then a clinician yourself, and then back into the research. I'm not gonna ask you to pick like which one is your favorite. I'm sure everybody have their own favorite, but it's interesting to hear that because of your background as previously as a clinician, then it moves into doing research. Actually, it brings a lot more sense that to put things into a picture and for us to understand. Maybe you can since we have a bit more time, so I want to dwell a little bit like a medical background person and then jumping into digital health. That is actually quite scary, isn't it? You want to share a little bit like that kind of barrier? What did you do to cross that barrier?
I okay, so I start with biomedic. Biomedic is about research as well. So it's about laboratories and all. But I'm very fortunate because from biomedic to medical, I can see the full circle of what happening, from diagnosis until the management of patient and all. And it makes sense when I practice. And it's easier for me to understand certain concepts and why we do things the way we do it. So moving, jumping from surgical to research is not really a scary part. I think the scariest one is when coming from biomedical jump to medical. But now doing clinical research, I'm very happy to say, I have the good thing from both world, medical, and I also have technology. I'm not a coder, but I understand a lot more now, and I'm confident enough to talk to Freddy and doesn't feel like alien. So yeah.
Yep. Thank you so much. So actually you brought up that horizon, Actually, we are not aliens. Sometimes I try to explain to people, we are not aliens just because we have a interdisciplinary mind. It actually helps us to really understand a little bit like, this digital health that we're talking about. And obviously, as we dwell into this topic, you will realize that we are somehow a very special breed in a sense that we do technology, we also do health related stuff. So, it helps us to understand that perspective better. Thank you, Dr. Aizuddin.
Correct.
I'm gonna move the attention now to Freddie. So Freddie, I want to ask you, actually, maybe you can share with us a little bit, from the industry point of view, like because like Dr. Aizuddin comes from a ministry. Ministry has a very different perspective when moving digital health or even moving any kind of effort. Is always a top down effort, and then after that the reflection is again from bottom up, is like how things move. But from an industry point of view, I don't think you guys actually look at the government's area, or you just move according to the trend. Can you share a little bit about this?
So, thank you, Doc. So from a macro perspective, my coverage is cross industries. So whenever there is a problem, then we'll try to solve the problem in tech, right? It could
Right.
be medical, it could be non-medical, it could be agri, it could be oil and gas and whatnot, right? And coming back to your question about trends, right? I think I can easily sum up that now in Malaysia, in Southeast Asia, in the world right now, we're at a very interesting phase.
Okay.
Tech has been driving a lot of changes for the last 5-10 years, right?
Right.
Last 30 years after World War II and whatnot, right? We've seen massive improvement, right? But the rate of change and adoption of digital has been accelerated through COVID. So COVID is not so bad, right? Pandemic. And it has accelerated and it has proven to the world that no, there's a lot of opportunity here. So I think from a tech perspective, I don't think there's a lot of doubt that a lot of dispute that it's very exciting right now. Yeah. And let's peel the onion a little bit more. Tech used to be confined to the largest organization. It has been liberalized. Everybody has access to it, right? Any 12-year-old with a parent's credit card can build an LLM model. So tech is liberalized, everybody has access to it. So okay, great, right? So tech is moving fast, everybody has access to it. And let's talk a little bit about Southeast Asia and Malaysia. Rising income, people are getting a bit richer. When they're getting richer, what are you concerned about? Health, right? It's not about food on the table, it's not about nicest handbag, it's about health. So now there is a demand for health. So I've got tech, I've got a power of tech, I've got demand of health, and I've got a growing middle class. And what COVID has also taught us is the importance of health, right?
Right.
No point, right? No point. You are so rich and whatnot, and suddenly you just drop dead and you die and got all the money in the bank, right? There's no point. And all these are converging forces, which suddenly opens up this opportunity for digital health. So digital is not really about treating a patient, right? It's really about the holistic healthcare. Think about it, right? It's about lifestyle. It is really about preventative. It's really about diet and whatnot, right? So you need to sum up about for fellow audience, right? Young aspiring students. I think digital health is a place to be. For very simple reasons, because there is a demand. You are blessed with a set of resources. There is a demand. Now, question is, how do you leverage that to make a change?
Right. So you talk about demand. I'm gonna dwell into that demand thing. Whenever we talk about demand, we are very worried about, is there a validity of that demand?
Yeah.
I'm not sure if you understand what I'm trying to
Yeah.
say here. Sometimes when we have a hype
Correct.
on certain thing. I mean, just give you a very simple example. My Sejatra, it was a hype.
Yeah, correct.
And then after that, it comes down again. So the demand, there's actually a validity of in terms of
Correct.
demand. So since you talk so much about this demand and all, so are we
Like a
going to
fad, right?
lose? Sorry?
Like a fad, right? Eventually it just dies off.
Yeah.
Yeah.
So
Yeah.
so are we going to see like this digital hub is going to dive off after some
Yeah.
time?
When you say fad, I think about bubble tea. I don't know, Prof, in US have bubble tea or not, right? That's a crazy demand for bubble tea over here many years ago, right? Popping up, right? And just dies off, right?
Well,
How,
I think it's still a demand now. No?
okay,
Not
maybe
as much.
there is still maybe I'm just cutting down on sugar, that's why.
I see.
It's not going to go away. People's lives are getting longer,
Mm,
right? People's lives are getting longer, you're getting richer, right? Health is a common theme from now, 100, 200, 500 years ago. Health will always be a common theme. Yeah, we want quality of life, we want to live long, we want to be healthy, we want to be able to run, we want to play badminton with our kids, right? So that's not going to go away. In fact, with the whole thing about people living longer, we'll have a new problem, aging population. When you have aging population, when you have a little money in the pocket, what are you going to spend on? It's not the next smartphone or the nicest handbag, right? It's really what can prolong my life or what can make me live a little bit better, a little bit healthier. Yeah, for myself. Yeah, I think so. That's long answer short. No, I don't think that's going to go away. In fact, it's going to grow even further. Yeah.
Wow. Good to hear that. I think a perspective that we could share with our audience here
Yep.
is that digital health is not just about health, it's also about well-being.
Correct.
It's actually a long list, things that is related to health. So
Correct.
we're not just talking about your visit to the hospital, but
No.
we're actually referring to how you take care of yourself. And that
Correct.
is like a very long thing. Even wellness, we're talking about wellness.
Correct.
We talk about tracking our own fitness. All of us
Correct.
want to track our fitness. We have a smart band, a
Yeah.
fitness band, a smartwatch, trying to be fit and all. I think these are again opportunities. Lah.
Yeah.
And it's really so integrated with our life, and we wanted to harness all of this. So thank you for that perspective. I'm gonna move over to Dr. Helmi a little bit, because Dr. Helmi, I remember during the pandemic, because I stay in Selangor, so I'm gonna be very honest. I stay in Selangor, and that time, so Prof. Shankar, Selangor is a state in Malaysia, yeah. So in during the pandemic, because we have a control movement, so we couldn't move everywhere easily, and we started off with some contact tracing application, and then after that, it actually expanded. So the Selangor state actually went all into digital health, and in fact is still doing better. So I think Dr. Helmi, you are the best person to share with us a little bit. So like maybe you can share with us from that perspective, like from the health, from the state government point of view, or maybe like yourself, because you're also from a tech company. Like how do you see yourself coming into a solution provider for Selangor state?
Hmm. Okay, hold on. Okay, so that was a pretty long question. I'm trying to think how to summarize that.
Okay,
Okay,
let me cut it down first. Since you're a solution provider, I'm sure when the government came to you, they come with
right,
a problem. So you're supposed to solve the
right,
problem.
right.
So let's
So
let's
I
go
think
from there.
I think yeah. So I think jumping on that, right? Mm, I think I'm a bit more like Dr. Izzuddin here. So I'm firstly being trained as a medical doctor, but I do have a specialization in public health, and over in public health, usually, uh, unlike people in clinical medicine, we are quite underinvested lah. So we are quite underinvested in terms of the tools that was provided to us. So a lot of things that we do in public health is they really macam, like we just wing it. Like you have to go down and do this Nipah virus outbreak investigation, and the only thing you have is basically your brain and your paper and pen. So there's no equivalent to an ultrasound machine for public health doctor. There's no equivalent to a electronic health record, which is usually people do it for hospital, but there's none that is basically being done for public health doctors. I think and when it comes to data analysis, right? And I know now like data analysis and data science, all of these are trending now. But we in public health and biostatistic. This is just a bread and butter for us. Even the first inception of public health landscape is basically a geolocation analysis of cholera outbreak. So I'm sure like all of you know this. But since then, since John Snow time until today, we don't even have a standardized disease mapping platform. You have FHIR, you have the interoperability standard for clinical record, but you don't have one for public health. That is how much public health tools has been underinvested in. I think it was from that realization that back in 2017, Izzuddin basically can attest to this. So working in public health, in Ministry of Health, kalau lah you seorang je yang tahu buat benda ni, if you are the only one that can do the data analysis thing, then all this work will suddenly being dumped onto you. People like to talk about the inside, but nobody want to do the legwork.
Correct.
And I'm lazy, guys. I'm super lazy. I hate doing repetitive works. I cannot handle FPSS. I think it's a dumb software. And basically it was from there. And I think sikit-sikit, I think it's important, especially among students here, it's important that when you go to the field of digital health, you want to be a domain expert first. So choose a domain that you are expert on. And in my case, I would say like my expertise firstly come on surveillance data. So that was very specific, surveillance data. And from surveillance data, I just like Dr. Wickett was mentioning just now, I got into a WHO internship program, and afterward, like a secondment there, in global health policy. And when you're in global health policy, never, this is just my opinion, never jump specialty. What you can do is like you can juxtapose it. So I'm in global health policy. So when you are in global health policy, I mean, global health policy are wide, and there's so many things you can talk about. You can talk about governance. You can talk about trade. You can talk about trade regulation, but you can also talk about international health data surveillance. You can talk about public health event of concern and how data are being transmitted across member states. So you do that. So I focus on that, and when you focus on that, you then start to understand, all the barricades and all the obstruction when it comes to processing data and make it wide. And usually it's not unwillingness. I know, kesian Azudin, kesian Minister of Health. I think a lot of people in Minister of Health have been saying that, like it's very hard to hard to get data from, like it's hard from one country to another to share. Sometimes it's not that, guys. Sometimes it's just there's just no standardized platform. There's just no standardized format that is agreed between two member states. Sometimes it's just a problem of lack of tools. So in WHO, I came up with a number of tools how we can automate and how we can make surveillance efficient. Even until now, I think my work, unlike unlike any other, I think technopreneur, which I think they do a really really trailblazing work. So they do a trailblazing work like using AI, using AI to read radiographic image, right? Or I think using AI to pre-screen diabetic retinopathy. All that sounds great. But because I'm still butthurt of the fact that nobody want to invest in public health, I don't do that kind of thing. My innovation or the work that I carry on has always been something that can contribute to the dimension of public health. So the work that I do is usually in terms of disease outbreak. Can you predict? Can you predict which area or which neighborhood will have future outbreak? Can you forecast how outbreak move from one part to the other? Can you tell whether in Subang Jaya versus in Sabak Bernam, which part of the demography will have higher likelihood of undiagnosed diabetes? And where we should then set up our health screening camp. If we got thousands and millions, or not thousands, not millions, like thousands and tens of thousands of bottles of blood sample, how do we cope with the bottleneck that we have in our lab? Is there a way we can use machine learning to prioritize which sample to be processed first? If we can profile the individual in advance before they give their blood, and you'd be excited to learn that there's so many things that you can tell about people even before the first gaze. I don't know, selalu cakap kan macam, don't judge a book by its cover. I don't need to see your cover. I don't need to see your cover to judge you. So what we ask people to do is like, the way you interact, where you live, there's only a single important number in, in public health that can really, really tell you about the outcome about your health outcome throughout your entire journey. And that is not your age, that is not your weight. I like to believe that it's not my weight. But it's actually your postcode. It's basically where you live, where you study, where you work, and so many things. You can tell so many things about a particular person just by knowing where they work and where they live and where they study. So it was from that. So we built solution that help public health practitioner. But as usual, public health is not sexy. Like no parent will all parent. I'm going to be casually racist here. Like all Indian parent want their students like to be surgeon. Have you ever heard them like, I want you to be a public health specialist? I think my dad was upset with me when I choose public health as a specialty. But there is money in public health. There's money in public health, and why there's money in public health? Because public health is one of the field that produce so much machine readable data. So if you really want to engage into digital health, and if you want to make your starting point in digital health, I would say come get to know us in public health. Yeah. And Selangor government, basically because like clinical setting, clinical, and then you have to find opportunity because clinical care is not really under the state jurisdiction. So that is why with the Selangor state government, it's easier to roll out our solution because it's more oriented to public health. So find your client.
I see. Thank you so much, Dr. Helmi, for sharing that perspective. But when you were sharing, I got this thing that I realized that actually doing this kind of data analytics work and all, it actually also helped the government to be more strategically plan their surveillance, I would say. I'm not sure if I use the right term because I'm not a public health person. So does that mean that using digital health, using technology, or even using AI in the future, it might help the government or the state government to actually plan their plan before a pandemic
Mm-mm.
hits or before even any diseases that comes. Can I say that?
Uh, is that question pointed to me?
Yeah, I'm just trying to see,
Oh,
like,
okay, okay. All right,
is
all
that
right. Okay, 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 okay.
yeah, is that
Mm,
correct? Is that correct?
can
Like,
yes, yes, yes. I mean, do I have an opportunity to share my screen? Maybe it's easier to give like some visualization. Boleh kot?
yeah, maybe we
Yeah?
can do that for a few minutes. Yeah, I think okay if you
Okay.
can.
Okay, maybe yes, maybe not. Okay, so hold on. Okay, guys. Can everyone see my screen?
Yes, we can.
Oh. So
Test.
just some resource sharing. Like
Yep.
you guys got to check this website. So this is basically the organization that I'm a member of. Is an open invitation. So it was under ITU, WHO, and WIPO, a global initiative on AI for health. So if you want to get anything trending, just check out this website. Or it's related focus group. Where we were. Okay, so in Hayat, what we do is like we forecast disease. Imagine like people who forecast a rain, right? So you don't wait until the rain happen, and then like if the rain happen, and then you tell people like, hey, it's raining. Like, okay, that's gonna sound so dumb. So what you try to do is like you try to forecast it in advance, and we build our solution. So we build our solution we built like an OEM solution. So you have no brand. You cannot go to App Store and try to download a Hyatt lifetime health record or try to download a Hyatt online mental health support. You can't do this. But then you found a client that they into it, and with client, then what you did is like you customize and you fine tune your base software so that it can be adopted. And what the Selangor state government is doing now is like it is supporting the role of Ministry of Health. And when we say it support the role of Ministry of Health, it is not interested in the area of curative care. Selangor state government never have money to treat people when they sick. But what they can do is like to establish an early warning system, and to mitigate from illness even to take place. So, for example, when you put people under record Hayat, then you have an idea how a particular and individual health strand progress, whether their diabetic is under control or whether their diabetic level is trending worse. Same with mental sehat and whatnot. And it is this select number of people or select cohort of people that we managed to flag early in advance. These are the select number of people that we will intervene early on in the hope that they will not end up to be so worse that they have to be referred to Ministry of Health facility. So that is basically the policy direction of a state government, and therefore the solution that we build is specifically catered for that purpose. So you build a crowdsourced platform, a crowdsourced data platform where people can participate, public can participate. They can give their data not when they sick. They give or they share their data or their wearables data like while they are healthy, and we look into every touch point across the health system and we collect data, and that is when we forecast what are the likelihood or the outcome of this particular individual, and then you flag it up to the healthcare provider. So yes, you are right, but it's not necessarily only can be used in disease outbreak. It doesn't have to be only in infectious disease like dengue. So you can use the same concept, early warning system, early diagnosis, early treatment, prevent complication, reduce healthcare costs. And you can do that across all dimension of health.
Right. Thank you so much, Dr. Helmi, for that so comprehensive sharing. In fact, with your slide, I think it's like giving a perfect example to show, how things are being done. Thank you so much, Dr. Helmi. Okay, now I'm going to move to educational. So we talk a lot about, opportunities, whether is it at the ministry level or is it at the industry level. So honestly, there's really a lot that needs to be done. I think all of us start to realize that there is a gap that we need to address. Obviously, workforce is one of the biggest issue. In fact, in any country or even in any nation, workforce is the first thing that we go into. So maybe I want to ask Dr. Tan. Dr. Tan, maybe you can share with us. We talk about this digital health effort in educating perspective. So what do you see, like, how does educational provider perspective, how do we see this as an opportunity? That's number one, the opportunity that we see. Secondly, what is the university actually doing in order to address this demand in digital health?
All right. I will share starting from the initiative from IMU perspective, including why IMU actually started the digital health, including health informatics. So this was way before, I think in the 2018, way before the pandemic. They have this vision and mission to basically seeing the opportunity of digital technology coming into healthcare. Why I say so, I think it's not new in the world for digital transformation in healthcare. We can see there's many opportunities started from the US, the UK, and the Europe country, including the Australia, I believe, as well as New Zealand. But this is not something new for them, but it's very new to Malaysia. Hence, IMU have this vision to basically participate in the digital technology advancement to healthcare. So starting from the 2018, they have this vision, then they slowly come out with the idea and gather the task force, I will say, to try to work around with some computer scientists like myself and also Prof. Patrice, which actually was the head of the department and also the center. Then later, the pandemic hit. That's why it was delayed in terms of why it started only in 2021. The reason is because when we want to launch the program, the pandemic started. So we actually wanted to launch in 2020. So it's very unfortunate. But there is a delay and it's also a push, like what Freddie has mentioned. We leverage what we actually have encountered and start the momentum to push the program. So you can see that the milestone is actually that we started the negotiation and also the meetings among the education level in 2018. Then starting 2020, when we actually put up to the Ministry of Education and Higher Education to get the approval. Then the first cohort that we actually recruited as a students for the master degree in health informatics and analytics in 2021. Then followed by last year, we've launched the undergraduate digital health. So these are the initiative. And of course, if we talk about this year, it's also very interesting. We have a lot of MOU signing from the industry. And you can see over here, we have like 5 already, including the university from the US and also the UK. And not only that, in the beginning, January 1st, this year, we also had our center set up. That's me, myself, and also Dr. Yang was in Center of Digital Health and Health Informatics. So you can see that it's starting to come into Malaysia, and we are the first to shout out at IMU. Yeah. So I think this is something that we need to look into to nurture the talent to fit into the industry so that public health will have someone to look after and share together what we actually supposed to feed to you, and then we will also feed to for example, Freddie's company to look into the data side of it. And perhaps some can actually have some projects with the Ministry of Health. And those who are actually interested in to pursue further in international education, there is a platform as well. As this year, we have signed the MOU with Rutgers. And they are the health professionals over there. And I believe the programs has been started a decades or more, so much earlier than what we have here.
Right.
So that's also another purpose that we see the opportunity in Malaysia.
Right.
Yeah.
Thank you, Dr. Tan, for sharing that perspective. I'm a little biased here because I'm also from IMU, and I also happen to be from the same center. So I do understand the effort that is actually needed in order to set up the program. I must say that it's a very long journey. Things are a little different. I think probably it's the same in every country, but in Malaysia we have extraordinary steps that we need to do in order to get approval at every level. So to set up a program is really not an easy job. And by the time we started our program, things have moved so fast, especially we're in digital. This is why, we're always in discussion with a lot of stakeholders around, just to understand the demand, the trend and everything. How does it move? Like, are we on the right track? Because as an academician ourselves, I think Dr. Tan will probably agree with me that we are actually very worried that we train students, but the industry said we don't want. I think this is something that we're always very careful. So this is why we are very passionate when we go out to meet industries, because we want to make sure that are we training the students that you guys want? This is always the first question they will always ask the industry. I think that is very important. It's like a sanity check for us as well as an academic. It's not like we are very happy in our own university doing a lot of things, but then we do not know what's happening outside. I think this is a danger. I hope Dr. Tan you agree with me with this sentiment. That that's why.
Yeah, agree. Therefore, we really, really want the industry, like this platform, including today,
Yep.
to have a chat with and keep in touch, so that when we have feeding to the workforce, the gap will not be too far away.
Right.
Yeah, that's the
Yep.
ultimate goal that we wanted to fill. But definitely, there's still need to have some learning curve
Of course.
that the students have to go through. That is for sure. But we are trying to ensure the learning curve will not be too steep for these students. Hence, we have industry trainings in their final year. Yeah, that will basically help, including the research. So
Right.
as you know that today the trend is actually moving very fast. Resources wise is definitely there to basically help the students. So of course, when we talk about Malaysia students, it's slightly different compared to international standard. As you can see, my portfolio and bio is basically from the overseas university. Usually the lecturer will always come in not to lecture, but to basically discuss the topic that they want to deliver. So the learning time become better in terms of there is a I would say interaction and very interactive and happening in the class. While in Malaysia, it's slightly different. So we of course, as educations and academic, we try our very best to ensure that the students, those especially introvert students and slightly, I will say, if you're interested in computing and computer science or IT, I will say it's not so outspoken in terms of how they want to deliver the message, including the presentation part. So we are trying to instill this kind of talent and also, like I say, always feed to the workforce ultimately. Yeah.
Right. Thank you for that. So maybe just to add on one small little point, also this year the center actually set up an industry advisory board, and this is a very important milestone for us because this industry advisory board actually also drive the entire center to be more industry centric. So we have involvement from the industry to come in to advise us on the curriculum and then on everything. I think that also make us to be a little different. Yeah. So yeah, just to add on to that point, right? Thank you, Dr. Tan. I think we now shift our attention to Prof. Shankar. So we know that you're from the US. there are a lot of things that we want to ask you. So we're gonna start one by one. So we
Yeah.
probably, because we talk so much about, the digital health trend and everything in
Right.
Malaysia. So maybe I want to start asking, what is the trend like in US? I mean, I don't say in US, I don't know. Maybe you can share a little bit with us
Sure.
about these
Yeah.
digital health trends in America.
Sure, absolutely. Yeah, I mean, just to give you an idea as to the importance of digital health in the US, I'll start off by stating what the Office of the National Coordinator for Health Information Technology, this is the federal government's arm for taking care of anything to do with health information, resources and services, right? So they have stated that more than 85 to 90% of all health data is in the digital format now. So 85 to 90% of all digital data in the US is in digital format. So how did this come about, right? So in 2009, why I have to give you a little bit of a history is because it also mirrors what happened in our programs as well, in the kind of enrollment, the kind of students we got. So in 2009, as you might all know, we had the High-Tech Act, which was the Health Information Technology for Economic and Clinical Health Act, that was a 2009, which kind of required by first incentivizing all the physicians, all the providers across the US to set up electronic health records. Until 2015, they were incentivized, and then from 2015, they were penalized if they didn't implement it. So accordingly, the transition was made, but the transition was made from essentially from paper records to digital records, right? So from 2015 onwards, like, of course, since then, there was a substantial development of electronic health records across the US, and there were health information exchanges and, some kind of interoperability standards like HL7, they were all in place. But then came along in 2020, the COVID, and we thought we were in great shape. And when the COVID hit, we found out how disjointed the whole system was. We found that there was no seamless integration, of data flow to arrive at real-time decision making. As Dr. Elmi mentioned, for the public health, they were collecting the data, but they were not able to interact with the physicians in the current, the family care physicians and the government, and at the same time. So all these interoperability issues, all that came along. So accordingly, all this spurred attention of the CDC and the FDA and all of these health agencies in the US to come up with strategies just like you have in Malaysia, you have the 25-year strategy that they have come up with for digital health. CDC came up with the Global Digital Health Strategy and also the Data Modernization Initiative. So I believe digital health has finally come of age now. It has been in the works because our department has been offering the master's and the PhD in biomedical informatics from 2001. But since 2009 and again in 2015, around 20, it has seen a sudden spurt in our enrollment and such.
Oh, wow. Thanks for sharing that perspective. So you are at least, I would say, 10 years ahead of us?
More than that, but then you are coming at a time. No, actually, I wanted to say one thing, but because all these, we also learned, when we started our programs, we were focusing on at that time, the Human Genome Project was the main thing.
Right.
So we were all thinking that we have to train the workforce towards meeting those kind of demands in the pharmaceuticals and such. But then the Human Genome Project was made kind of open source, and all of the data was made open source, and the demand fell. So the student, demand for students and researchers also were there, but it was not as high as we had anticipated. But with the High-Tech Act, it brought about a complete change. Suddenly our program started to increase enrollment. When we had something like 10 students in the master's program in 2005 or 2006, we now have 80 students in the master's program. And in the PhD, in the doctoral program, we have 60 students. So huge demand. And we are now trying to contain ourselves by not admitting anymore, because we have to maintain the faculty to student ratio. So, but what I was trying to get at was, you are coming at a time that you have seen what the others have learned, the lessons that they've learned. And one of the important things that I think both Elmi and Dr. Izzuddin mentioned, and Freddie Lu also mentioned, is that now the focus should be on making sure that the translation is complete, that from the patient to the bedside, right? Like they say, and making sure that the patient or the consumer is held first, and making sure that there is a more of a continuum to the healthcare, not just treating their injuries or diseases and only on a symptomatic basis, but rather making sure that you are monitoring their health, like through Facebook, through Instagram, through all of those. I think, Dr. Vaikyat, you asked whether this is a fad. No, it is not a fad, because you need all of these technologies to be in place to get a complete picture of a person's health, as Dr. Elmi mentioned too. So, this is very critical for you're coming at a time wherein all the potential for not just being a passive member of the workforce, but to be an active member, meaning to have startups and such as well. So I think you mentioned just now that you have, you are able to take in students from across, not just those with a certain kind of a background, but we need people with a business background. We need people with a finance background. We need all of these, because you need all of these startups to be there to meet the kind of innovations that are required to bridge all of those gaps that have been identified. Because in a way, like as Mr. Freddie Liu had mentioned, because the global pandemic, in a way, it was a very horrible experience for everyone, but it also has given us an opportunity to mitigate a lot of gaps that were existent thus far.
Right. Thank you so much, Prof. Shankar. I think you also answered my question that I asked Freddie just now, talking about, is this going to be just a hype and then after that it will dies off? I think what you have shared, like over the last 10-15 years, you have seen that how it evolves. So it's not dying down, but it actually changes. But I guess the skill sets that is being trained then and also now, they are still the same similar skill set. So this is why it can be easily translated into a different field. Am I getting it right? So the skill set is important. Yeah. So I
the
think
basic skill set is the same, but there are newer ones like cybersecurity. That's a very critical aspect of all of the digital health. As we know, there have been so many breaches already into the healthcare data, and this is the most vulnerable data, as you can know, because that's like the core of the person. So cybersecurity, all of these are, yes, they're based on the basic structure of computer science, but now newer ways of programming, newer ways of system architecture. With having AI chips, what would they entail? Like what would they bring about, right? So these different ways of mind, turning your mind towards solving a problem. Yes.
Right.
We need new brains, and which is what you guys are doing a phenomenal job in Malaysia now in a big way, and in it's kind of mimicking or parallel across the global sphere now.
Right. Thank you so much for the encouragement. So at least we know, at this part of the world, we are not too shabby. Let's put it that way. So we are still, catching up quite okay, I would say. But Prof, maybe you can share with us a little bit. I think previously we also have a discussion talking about pathway, like how our student can actually go to your site, like how we feed our student to your site. Maybe you can share with us a little bit, like what are the pathway, if you remember, we have this master program. How does, sorry, we have a bachelor program. How do we feed our bachelor to your master, and then how does our master student actually fit into your doctorate program?
Sure. Thank you for this opportunity. In fact, our department has a master's in health informatics program, as also a doctor of health informatics program, right? So both of these have been accredited by the New Jersey state, and Rutgers is a state university. So these are well accredited and well known and well recognized programs. And now with this, we are very honored to have this partnership with IMU, that we can invite students who have done their bachelor's degree with a bachelor's of digital health at IMU. They can join our masters, and they can get a transfer of credits from their bachelor's degree up to 9 credits, which is something like amounts to a semester worth. Like basically our master's is 4 semesters long, let's say. So 1 semester they can save, and also accordingly that much of a finance, which is around $10,000 or so, and also the lodging and all of the things that are associated with that. So you have the the pathway from the bachelor's to the master's with the transfer credits possible. The same happens with the masters who have done like masters in digital health and or health informatics and analytics in IMU. They can join, like, can apply and get admitted to our Doctor of Health Informatics program, and they get again the same 9 credits of transfer from their master's credits onto the doctoral program. Again, they save the doctoral degree is around 3 years to, yeah, if it is an international student, it'll be 3 years. Again, with the 9 credits transfer, they'll be saving half a year's worth of tuition and also courses as well.
Wow, that's good to hear. At least we know that, our degree in IMU actually is on par, because
Very much so. Very
thank
much so.
you.
In fact, I have looked at the curriculum. It's phenomenal. You are like, you are very, very high quality and rigor. Like, definitely, the students will be very honored to have your students apply
Thank you
and
so
get admitted
much.
to programs. And also, I want to assure those with the master's degree from our program as well, like, and even the doctoral degree is a different ball game out there altogether, because they're already at a specialization level. So it's different. Right. It's difficult to generalize them. But the master's students get jobs as clinical data analysts or data specialists or data managers very easily now, because all of these changes that I talked about with the ITEC Act and all of the interoperability issues and such, they also have brought about a requirement for quality assurance in the hospitals, in the pharma, like adverse event reporting and such. So all of these have spurred a lot of jobs available, being made available. And our students find ready employment. In fact, our students come with background in business, dentistry, medicine, biotechnology, so it's a varied cohort that we get. And they all get to do well. Because we have modified the curriculum or made it in such a way that they are quickly trained and brought to speed.
Yeah. Wow. Thank you for sharing that piece of information. In fact, you actually helped me to transition into my next phase of my question. That, we talk about career opportunity, we talk about study opportunity. So maybe I will go back to Dr. Tan. So let's talk about the IMU programs that we have a little bit. So maybe you can share a little bit with our audience, like, in order to join digital health, is there any specific requirement that a student must have? Again, because as academic, we go on road shows, and when we do road shows, the first question parents will ask is that I must have science, right? My children must have science. Is that the first question? And then after that, ask, oh, do you need a mathematic requirement and things like that? Maybe Dr. Tan, if you can share a little bit from that aspect.
Yeah, actually, the things that the students need for to enter into IMU Digital Health undergraduate program is basically I would say mathematics is still very important. Then definitely will be your foundation level or A levels. So this is basically the entry requirement. Yeah. And of course, to enter to IMU foundation in science, definitely you need to have sciences. But if you're coming from foundations in art, you are welcome, as long as your SPM level, you have mathematics or any higher mathematics to basically replace the SPM level. Like, for example, a lot of students nowadays coming from international school, you can basically use that as the entry requirement. If not, then you can do somewhere else with your foundations and then join us later on. We also accept the UEC from those Chinese independent school. You can actually join us as long as your highest level of your education could prove that you have the English entry requirement. Yeah. If not, then we will just we will actually inform you to either take the IMU English test, or you can actually take the English test outside, like the some of the IELTS out there, or IEEE. Yeah, as an entry requirement.
Right. So maybe just now you mentioned about foundation, right? So maybe I think we can let everybody know that IMU is actually launching foundation in arts very, very soon. So that also opens up another opportunity for students who are non-science to actually join this field. Because honestly, to be in digital health, we are not just looking in science background, but it's a lot about creativity as well. So the integration of science and technology with arts is now becoming more and more important. So this is why we're opening up this field to the non-science student as well. So this is another way of attracting non-science student to be in a medical or health related field, but also with integration with digital. Right. So what about the master's level? Will you be able to share like entry level for masters? I think all our students who join masters need to have a bachelor degree, isn't it? Dr. Tan? Yep.
Yeah, yes, you can actually have master as well if you want to have another master in health informatics. We don't stop you. As long as you have the basic bachelor, you
Yep.
can come from any way, like what Prof. Shankar has actually mentioned. We accept you if, let's say, your first degree or your highest degree is basically like a dentist. We welcome you. Medical background, that will definitely a plus side for you because it's considered as upskilling and reskilling your current knowledge. Next is definitely if you have, like myself, you will have like computer science background or IT, you are definitely a good choice because we are using the data analytics skill and apply in the healthcare data sets. That
Right.
will basically, I would say, escalate how you actually understand technology. And definitely, we will also give you some of the modules in the healthcare organizations. Yeah.
Right. Yeah. So students who doesn't come from medical background, basically we have specific module to equip you. I'm referring to the postgraduate program. So if your background is non-medical related, we actually have modules that help you to learn about the health organization perspective. And if you don't come from a computer science background, we actually have modules that actually help you to learn in Python, to learn R programming and things like that, database and stuff like that. So the PG program is the postgraduate program is really a very nice mixture of health and then also computing it in a way that when we train a student, they get both from both sides. Yeah, just to add on to the point to that. So maybe because Prof. Shankar, just now you also talked very lengthy about coming into Rutgers. Maybe you can share with us a little bit on the entry requirement, maybe to get into the master's program or also the doctorate program. Yeah.
Right. Yeah, sure. Yeah, for both of them, it's more or less the same. Of course, the qualifying degree for the master's is at least a bachelor's degree. As Dr. Tan mentioned, we also have students coming with another master's already, like an MPH or whatever, or MDS or dental surgery. So, so the basic qualifying degree for the master's is a bachelor's degree. And besides that, we don't require a GRE because we don't believe in GRE, but rather, what is their overall profile? What do they bring to the application, right? So if they have a strong interest in healthcare or anything of any of that nature would definitely be of help to the student in doing well in the program, And of course, if they have some knowledge of a priori programming or they have interest in quantitative skills, that will be helpful as well. But from the admission requirements perspective, it is just having a bachelor's degree for the master's, and for the doctorate degree, it is a master's, at least a master's they have to have completed, And then besides that, the usual, such as like letters of recommendation, a statement of interest and such, So we don't require a GRE. That's one of the questions that most students, applicants will have. Basically.
Right. So if they want to know more information, I'm sure they can go to the website and have a look. I think
Absolutely.
the website is so comprehensive. Thank you so much. I'm going to move back to my industry speakers now. So of course, we talked very lengthy about education perspective. We know how important it is to get the right certificate, the right qualification to do the work. So the moment of truth is that we have complete our education now. Now we are supposed to go out to work. So I'm going to throw the question first back to maybe Freddie first. So maybe Freddie, you can share with us, like from an industrial point of view, actually, what is what just now we talk about trend and we talk about opportunities, right? So from a career perspective, right, can I safely say that there's actually plenty of job available out there for this digital health hype here?
Yeah, thanks, Doc. The obvious one is obviously This is a course about marrying tech and healthcare, right? So
Right.
career in as health technician, clinical analysis, health informatics, all these are very relevant. And it's very obvious, right? So that's fine, right? I mean, that's an area where students, right, potential, there are potential areas where they can grow their career. But what I wanted to highlight is also in this day and age, the skills are very transferable.
Mm.
So you're not confined to be just in healthcare. And you
Right.
start noting the trends whereby, people who studied healthcare don't end up career being in healthcare, right? So I think what's really key for potential aspiring students is that, your skills are very transferable. Your decisions that you make today for digital health
Mm.
doesn't mean that you're going to work in that field for the next 30 years of your life. So don't worry. What's important is the ability to solve a problem. Yeah, it's problem solving skills. And there are some fundamental shift in the world again, right? And one of which is the availability of knowledge. That's 20 years ago, right? I tell people this, right? When I was graduating, there are export controls. Access to certain technology is not available to countries like Malaysia. Yeah. Today, everybody have access to anything, right? Yeah. So
Yeah.
it's really the applicability
Right.
of technology to solve a problem today, right? And if you think about it, right, this is not how well you code Python. This is how well you conceptualize a problem. It's
That's
very soft. Back to your point again, right? It is
Yeah,
really,
agree with you.
thank you, right? It's really the softer side of things, right? The
Mm.
softer side of things, the ability for you to converse, contextualize a problem,
Mm.
get resources, pull it together, solve a problem. I think that's the secret sauce, right? No longer the best person that can code the most complicated Python wins, because there's this thing called the Stack Overflow.
Yeah.
There's this thing called ChatGPT. There's this thing called no code, low code, right?
Yeah.
So, but there are careers for very deep skilled programmers. They're still there, right? There's still the world still needs people like that, right? But then again, reflect on yourself again, right? What is your profile, right? Yeah. So a couple of things take away. High skills transferability. Don't worry, whatever decision you make, you're not going to suffer for the next 30 years. Uh, don't get too hung up about being the best programmer in the world. Really, ultimately, what sells, what your bosses want to sell is, are you able to solve a problem?
I
Yeah.
think
And,
most important thing is they are able to work from home.
oh, perfect. I'm home. That's why I'm wearing this. That's why I cannot stand up. I can only show you the top half of my screen, right? Yeah. So I need to sit down. Yeah. So and ultimately, as potential employers, I was in consulting, it's really your ability to learn, your ability to solve a problem, your character, your empathy, your soft skills. Think about all these things, right? Empathy, bias, soft skills are things AI cannot do. And this is where you're going to, AI is going to help you do the difficult stuff. You're going to do all these softer side of things, right? Couple more things I want to highlight is identifying bias is also going to be a skill that's very, very important next time. I call it the bias scout and many terms for that, right? Yeah, it's a new role. This job didn't exist when I started my career, right? ESG is going to be big, right? Yeah. Equitable education, equitable healthcare. I think that's going to be very, very big as well, right? So these are the some areas to think about.
Right.
So I'll just stop there.
Thanks, Freddie. So, Dr. Helmi, I see you keep nodding your head. I believe you would agree with Freddie with a lot of skills that he talks about. You want to add on to that list? What do you think? Career perspective.
Yeah, yeah. I think I'm just going to validate whatever is it that Freddie said, because guys, I run two startup. I mean, I run two digital health company. I still like to call it a startup, but somebody have told me it no longer qualify as a startup because apparently I no longer qualify for that grant. So anyhow, um, mm, so anyhow, yeah, I run two digital health company. I understand analytics and I understand biostatistic, but no, I cannot run a single line code of Python. And apparently I'm a CEO, and that's fine, guys. Like exactly like what Freddie said. So machine learning, data analytics, your AI is all a tool, right? So I mean, the sexiness of ChatGPT is not the LLM. The sexiness of ChatGPT is what kind of plugin you produce later on, and like how can it make your work efficient, right? So I think and if you ever come to work in my company, right? If you ever come to work in my company, so I don't really ask you like how fast you can code in Python, just like Freddie said. No, no. your first interview question would be a question of a root cause analysis. It's about problem identification. It's about design thinking. So how do you identify this as a problem? What would be the step that you take in order to solve that problem? Or do you even see that as a problem in the first place? And that relates very, very well to what Freddie said later on. So you see, like, there are just some things that you need to do, like, based on your gut feeling, especially in public health, because the tendency to train an AI model using the data that we have, but there's no a good public health doctor, a good practitioner, a good digital data practitioner, right? They would first look at that data and would first question its validity. And the way we collect our data nowadays, like what Freddie said, is very, very biased. Like it's skewed into a certain segment of population. And not to say that those data can't be used, but you must question everything. You must question everything. And I think that is something that, at least for now, the AI wasn't be able to do yet. And that is basically where I think you should hone your skill. So go to this IMU digital health course, but don't swallow everything as it is. Whatever being taught by Dr. Wei Kiat, be very, very suspicious with her teaching, you know. And then what you want to do is, like, you want to question, you want to post question, you want to challenge the hypothesis, you want to come up with another solution design, and that will make you be employable.
Totally agree with you. But I think coming from an educational point of view, it is our job to tell you what kind of skill that you need. But ultimately, you need to nail it and you need to find your own niche. I believe not every one of us are programmers. I can't do programming too, but I can understand. And that is very important. So if you are a hardcore programmer, then you become a programmer. But if you cannot be the programmer, you can be the manager. So I always make that joke out of it, like to tell sometimes we don't have to really focus on a specific skill, but it's more like how to fit into an organization. I think that is more important rather than just having all these skills lying around and you do not know what to do with it. I think, yeah, it's important to apply in that. Thank you for that, Dr. Helmi. So I want to go to Dr. Aizuddin. So yeah, maybe you can share with us from the ministry point of view. Is there actually a job opportunity like doing digital health at the ministry level? Perhaps we can start by doing some research or anything.
I'll start with disclaimer first.
Okay,
have
disclaimer.
you have to apply through our JPA to get work in government. But what I've seen is actually, from the day I start my work as a houseman, as a medical professional, there are a lot of things that I questions in terms of the redundancy, in terms of something mundane, there are a lot of things that you can do automation. Then I start reading about IR 3.0, and I think we're still there. A lot of automation still working on. There are a lot of new materials discovered and all. So, when it comes to 10 years in ministries, I hope that the new generation will come and have a lot more. One is for medical professional, they need to have in-depth understanding of their core work. And then second one, when they have, especially for masters, when they have the digital health, it's easy for us to work together with, again, I quote Freddie, because he's one of the friends that I know. When we talk to programmers, we talk to data scientists, it make much more sense, and the conversation is not awkward at all. These are the things. And by knowing the technology, there are a lot of things that we can focus more on the more important thing. Like, for example, I have friends, in pharmacies, like for example, they spend a lot of their time packaging the medication and all. So, these are the things that can be automated, and they can spend more time with patients, educating patients. That's what they do best. But people don't see that because
Yep.
they're stuck in at the back of the counter doing something else. And some of the documentation as well. Like Dr. Helmi was mentioning, in public health, there are a lot of data, but a lot of us don't understand what the means of that data and how they actually can change life, not for the patient only, it's for the medical professional as well. We've seen a lot of data in even tertiary care now becoming digitalized. So if we can utilize that, it, I'm sure will do wonders. Yes, of course. US have their experience, and when they digitalize, there are some hiccups and all, but these are things that we can learn, and it's a good opportunity that we can learn from them. To be smart, you don't have to fail. You just need to learn how people fail, and proceed with that.
Smart.
So yeah, those are the things. I think it'll be very interesting to see technologies come into service and help us improve and deliver much I can say things that matter to patient,
Right.
things that matter to the society. And we can focus more on doing what we do best, talk to the patient rather than talk to the monitors. Yeah.
Thank you for that. It's such a good reminder, that yeah, the role that we have for every job is different. Demand for every job is different. I think we ultimately have to ask ourselves, what field that we are good at, so that we can be the best out of it. Thank you for that. So I think we have done almost most of our sharing, but interestingly, there are a couple of questions. I think speakers probably can see the Q&A as well. So I'm gonna like slowly address the question. So for other audience, yeah, you can start typing your question in the Q&A. Hopefully we have enough time to answer all of it. But we already have 4 questions here. So I'm gonna start by reading the first question. Good evening, all distinguished speakers. Recently, the introduction of CCMS at certain health clinics has raised concern on health data cybersecurity. What are your views on this client cloud system, and what are steps forward to address this? Maybe I'll probably pose this question to either Dr. Aizuddin or Dr. Helmi, or any one of you would like to take this question?
Right.
The
So maybe I'll and probably I will answer this.
Thank
I
you.
mean, Dr. Iziri probably would want to answer this from a regulatory perspective. I wear two caps though. Like in Malaysia, I'm an innovator, but in Chatham House and in WHO, I'm a regulator. So there need to be a very fine balance when we're talking about a risk and benefit.
Right.
I will pose. I mean, I will first answer this question with another rhetorical answer. Oh, but this is bad. But I like to do this sometimes. So cybersecurity risk happens everywhere and every day. And we have seen breaches. We have seen breaches of data. We have seen breaches of data in the financial industry. We didn't tear down the digital banking infrastructure. We have seen breach, for example, from the airlines industry. We didn't decide that everyone then should forego those
Fine.
industry, right?
Yep.
The idea is not it's not necessarily black and white, but it's mostly on how do we mitigate this risk? How do we mitigate this risk? And it doesn't mean, and does data being hold in a particular physical a particular physical place, does that even more secure from a cloud-based service? You can ask you can ask a lot of our ministries lah on that. And sometimes pooling resource is also a way how we pool risk. And that's basically the concept of cloud. And if you are, for example, if you are in the health industry, right? And the very idea of insurance policy is when we, many people, pull our risk together and contribute, and therefore we can have a safety net. When one offers, like, so that's the same. Like, if you want each and everyone here, like Dr. Aizuddin, to have his own server and put on his own cyber security setting, he have a lot of money. He will have a better cyber security setting than I am. Then, but so uh there's no definitive answer to mitigating cybersecurity risk in healthcare or in any industry. But what we need to have is that we need to have a continuous and iterative measure. So
Right.
it means like cloud is a must, because if you don't use cloud, then there will be no seamless data transferability. Cloud is a must because without cloud, it just gonna increase the cost of digital health, which will translate into the medical inflation cost. So it's a must, but then how do you mitigate the measure? And
Trust.
I think this is where we can have a better practice
Yep.
in terms of cybersecurity. So like I would start first with a set of standardization, right? So it's a set of standardization. So I think what we can do if CMS, a clinical management system, are to be regulated like a medical device, right? We can first start it as a brand endorsement, like how we do for nutrition labeling. This food is good, green color, and this food is bad, no color. We are not demonizing any software, but we're just telling like which software is better. And that's one thing that we can do actually. Um, uh, Recognizing certain software that have reached certain standard, and then what you will create is you will create pressure on the demand side to adopt this. You educate people that it's better for you to adopt this kind of healthcare digital health platform because it got a good brand stamp on it. So
Right.
that's one thing that we can do. Do you also know, to whoever asked you the question, because it's anonymous, do you also know that's actually one of the way that you can do to protect your health data? Make sure that you subscribe to a platform that encrypted your data so well that even if your data leak, it's anonymous.
Yeah.
For example, today, I don't even know who is asking this question,
Yeah.
right? So that's actually quite a good practice. That's basically how you protect your privacy identity. So you see, Zoom able to do it. So I'm pretty sure like this future student of ours will also have the same concept of design thinking. So
Right.
you can't avoid leaks or breach,
Yep.
but what you can do to minimize the risk.
Right.
Mm.
Well said. Thank you so much, Dr. Helmi. It's not that when we are afraid we stop doing. I think it's very important that we acknowledge what are the risks, then we learn how to mitigate, how to solve that. Thank you so much, Dr. Helmi. We move on to the next question. Will
Uh,
Prof? Yeah,
yeah,
sorry. Yeah, Dr.
nothing,
Aizat.
nothing. I just want to add something.
Sure, sure.
I have the opportunity to talk with not to mention the company, one of the largest cybersecurity company in the world.
Right.
And 1 week after I talked to that person, the company got hacked. So the lesson here is it's inevitable, but we need to be vigilant about it. How fast we recover that we are data breach and things like that.
Right.
But I think in terms of from regulators or even from MOH point of view, when we share data, there are a few things that we need to take into consideration as well.
That's right.
Some data doesn't look like it's sensitive in the upfront. Like for example, there are cases where it's actually open data that people share their wearables about their jogging areas and all. From that data, actually, when they publish online, what happened is some of the areas are darkened. You can't see anything. So what people extrapolate from that, this is where the army base are. So this kind of things is, I think, that makes sharing health data is something that you really need to think whether this data may harm someone or not. So I think that's why the slowness. But again, we can learn from other countries. They already failed a lot of things. So yeah,
Yeah.
we should be able to move faster.
We hope so. Thank you so much, Dr. Izadin. Thank you so much, Dr. Helmi. Let's move on to the next question. I realize that we have quite a number of questions and we have limited time actually. So very quickly, second question, will Prof. Shankar be delivering some lectures in IMU in virtual platform for the master program? Ha, interesting. So I'm gonna say that you will know when you join us. So I'm gonna keep the suspense there. All right, let's move on to the next question. Thank you for the informative discussion, especially liking the humor of the speakers. So thank you. I'd like to ask, what do the speakers think are crucial characteristics that industry is seeking in employee or students that are being nurtured? And what is the gap between the current education offering in digital health and the demands of the working world? Maybe I'll direct this question to Freddie. Freddie, will you be able to help us to answer this question? So this is talking about the crucial characteristics. I think you already shared
Yeah.
just now, a little bit. Maybe
Yeah.
maybe you can show us the gap between the education that we're providing
Yeah.
versus the actual person in the working world.
Yeah. I've shared earlier on, so I won't repeat, right? A couple of facts, right? The world's moving very fast. You are expected to solve a problem that hasn't been realized yet. So you need to solve a future problem.
Mm.
So which means that you need to develop a set of skill sets to solve a future problem, right? University is not going to teach you what problem to solve in the future, but to provide you with a set of tools to solve a problem that no one knows at this point in time. And that's the reality of the world, right? And I think that is the kind of mindset that aspiring entrepreneurs or employee needs to have, which means that you have to be resourceful. You need to learn and relearn, right? Because the world's going to change, right? Learn and relearn, and then be able to like I keep saying the same thing, contextualize the problem. I think that's a bit of a skill that has been sorely missing, the ability to conceptualize a problem. Once you're able to do that, because like I tell people, right, the world's a big place. Whatever problems that you see today, chances are someone in the world will have solved it today. It's very rare that you will find a very totally unique problem, despite the fact that all of us like to think we're unique. It's very rare. But the problem is not able to contextualize the problem, because you'll be able to find that. Just go internet, find the answers, don't worry. You won't, chances are you'll find an answer.
Mm.
That's it.
Thank you, Freddie. Thank you so much. Okay, let's move on to the next question. I think I missed this question. What is the difference between digital health and digital medicine? Can both be used in research, as we know consent in research needs to be face to face, not by remote consultation? Can data from both be used as research data? Mm, would Prof. Shankar want to answer this question?
Sure.
Yep,
Sure.
thanks.
Absolutely. Because I think it's a great question, honestly. I mean, research in health or digital health is not just confined to the bedside or something to do with the treatment of the person. Yes, that's a very critical part, but there are other aspects. The overall continuum of, that's what I mentioned about the continuum of health, is that it is about their well-being as well, right? I think Dr. Vaiket, you dwelled on it a little while ago. It's about their well-being, and especially for for example, post-surgical care or post, like, some treatment, like, how are they doing? Many a time the patient would want that person on the other side, not necessarily face to face, even remote is a phenomenal way of approaching or building this rapport. In fact, one of my PhD students, she created for her company, she created this chatbot for figuring out whether having the chatbot for the post-surgical patients, like, communicating with the doctors or the PAs, the physician assistants, would that be helpful in mitigating or reducing their recovery or improving upon post-surgical complications? Guess what? It found it was very helpful, because the patients were able to get immediate response, even albeit via, like, telemedicine, right? So to answer your question, research needs to be done on such aspects of as well, on telemedicine or remote consultation, to know how effective it is. I think Dr. Elmi mentioned it like earlier, Dr. Izudin also, about the outcome, the evidence. We need to have evidence for all of this, right? So it does matter very much so, yes.
So Prof. Shankar talk about surgical, I wanted to tackle these questions as well with I think Kashmir was asking about how reliable are diagnosis and prognosis from doctor in terms of telemedicine. Yes, we can't diagnose patient without palpating them, but in case of Prof. Shankar, our earlier project, in digital health, we actually wanted to do remote monitoring for post-op patient.
Mm.
So in this category, we pretty much know what we are looking for. So it won't work for all cases. So each patient will come with their own set of problem. That's why the regulation is there to ensure that both parties are covered. Like for example, I think one of the things that will be very difficult in terms of telemedicine. In Malaysia, you need to see the patient first before they can become your patient in telemedicine. I think the idea behind that is this patient before you start seeing them virtually. But anyway, the regulation is there to help, but it's not for every disease. It doesn't work like a normal clinic visit. But there are a lot of things that digital can help. Like for example, if you have mental health issues and you're very shy to talk to, man is difficult to say that no, we are feel vulnerable today and all, and talk with other colleague is kind of embarrassing. So with digital, you can do that anonymously and get some help, at some point of time. So these are things that technology can help, but it's not a silver bullet. Yep.
Thank you so much, Dr. Aizuddin, for that. Thank you. So I'm going to move on. One more question for Prof. Shankar. Do you have students who are clinician, practicing doctor, and at the same time they are into health informatics? During COVID, he has seen emergency physician who is also a master in health informatics develop a system to track COVID cases in his own local hospital. Would you have any example to share?
Oh, yes, absolutely. In fact, many, no, I wouldn't say like in a majority of our students are medical doctors by background, quite a few of them are, and many of them were also practicing physicians. Even now, currently a practicing physician from our own university hospital. Like he is the chief of ambulatory care, but he's doing the master's program because of the digitization of data, health data, and the need for knowledge of this field. It is not just having a degree in medicine that's helpful. You need to have this extra degree as well. And they all find it very helpful, like, translating it back to what they are doing at their workplace. Yes.
Right. Thank you so much, Prof. Shankar, for the perspective. I think I can also share the perspective from our own IMU, MHIA. We do have a number of students and also alumni who alumni means they have completed that they themselves come from clinical background, and because of their interest spur during the COVID time or even before that, they already have an interest into health informatics, and then they embark into this journey, and today they are more confident clinician, they are more confident doctors that knows how to make the right decision based on data. So rather than just making decision out of the moon, but now they are able to do more data driven kind of decision. So I hope that also explains from the IMU perspective. Thank you. So yeah, let me see. Oh, okay. One of the student, sorry. Okay, so one of the question I think is referring to Prof. Shankar, whether Prof. Shankar is coming in. Yeah, we hope to see Prof. Shankar soon. Okay, thank you. Then the last question, focus area meaning like within the realm of health informatics, one doctor can focus mainly on health education and doctors. So was curious to know all the areas available. All right. I think you wanted to know like in digital health, is there like a specialization in the field? Maybe
Uh,
I can pass to Dr. Aisuddin.
so to be honest, no, at the moment. But like there's hope because like for example, public health was once not considered in the NSR. So and then a lot of specialty coming into national specialist registries. It was talking about Malaysia context. But I think you have to understand a few things in terms of the specialization. If you looking for specialization in MOH, the area of focus or area of interest slightly differ. It always goes back to the treatment of patients and things. Technology is never there. I think the closest one we have in NSR for technology is transfusion specialist. And of course, public health with special interest. But we also have effort to at least acknowledge people with special interest in digital health, especially looking from SME point of view, a subject matter expert, and a focal point for us to move forward. So those are the things that we've been trying to achieve.
Right. Thank you. Thank you so much, Dr. Aizuddin. I think we have answered all questions. Oh, the last one. This is from Iman. Is there any ways to tackle the EMR data stored in overseas cloud? Recent case in CCMS that MOH start using is supposed to be stored in local, but to their surprise, the vendor subscribe to overseas cloud. Not sure. Anybody able to answer this?
Not really a
EMR data.
direct, not really a direct answer because this
Yep.
might touch on policies.
Right.
But what I can say is that we're still evolving. A lot of other countries now have patient manage their own data. So when they travel overseas, they can bring their data together with them, and then they have the ability to share that data on their own. There are few things that we need to understand. One is the level of digitalization. Second one is the education, or in terms of understanding of digital your health record, and how important it is for you to keep your health record yourself. I'm sure if we give our record now to all our patients, they will just put it on the Facebook or other social media, and that's about it. Everybody will have a lot of troubles.
Right.
So those are the things.
Okay.
Yeah.
Thank you so much, Dr. Aizuddin. I'm so sorry in view of time. We actually already overshoot our time. We're supposed to end at 9:30. It's already 9:44. So apologies, we cannot answer all our questions, but I want to really thank all of you. Thanks to all our speakers. Thank you so much for your time that you spent with us. I also want to thank the audience. Thank you for staying through. It has been a very impactful 1.5 hours, and I think that our discussion has been very fruitful. So again, thank you so much to everybody. We hope to see all of you soon. We hope to see all of you soon, hopefully in IMU. So if you are interested to join us in IMU, please do not hesitate to reach out to us, to our marketing team and all. So with that, we're going to end the session here by thanking our speakers. Thank you so much, Dr. Aizuddin. Thanks to Freddie. Thank you, Dr. Helmi. Thank you, Dr. Da. Thank you, Bro Shankar. We hope you have a good day, and thank you so much, everybody. Goodbye.